It's home to the most public housing residents in Cleveland. 73% live below poverty. With no prenatal care, very few pediatricians, 0 family planning services. Where 1 out of 3 visit the emergency room for care. This is the current state of healthcare access in Cleveland's central neighborhood. But not for long. Care Alliance is breaking ground for a brand new 30,000 square foot state-of-the-art health center right in the heart of the central neighborhood.
Care Alliance has always gotten a lot of support from the community, but now it's going to be more important than ever.
For nearly 4 decades, Care Alliance has provided medical, dental, and behavioral health care to thousands who need it most.
I didn't have a place to go, and I didn't know a place to go.
I've been homeless off and on for over 20 years. So, I've had quite a contact with the people at Care Alliance.
The new Central Neighborhood Clinic will serve hundreds of residents every day.
We will have medical exam rooms. We will have dental chairs or operatories. We will have behavioral health rooms. And then we have several community rooms for community engagement.
The new Central Neighborhood Clinic is at the core of a revitalization project that will transform this community.
There's community development, there's education efforts, and we feel that we can contribute as being the healthcare provider in the central neighborhood along with these partners.
So each and every service provider is playing together to make sure that the community really receives the best services that they could ever receive.
Care Alliance is leveraging a $5 million federal grant. New funding partners will secure even more support to complete the Central Neighborhood Clinic.
Care Alliance has a long history of building support from our local foundations and local communities in ensuring that we're able to deliver the care that we need and augment the funding that we receive from the federal government.
As a funder, we're always pleased when an organization can compete for other funding, and the fact that Care Alliance is so well respected that it received a major federal grant was great news. Now this community really has to step up and provide the match, and we hope the Cleveland Foundation's willingness to step up in the beginning will encourage the community to stand behind this.
In a community, every dollar spent on healthcare is known to move around that community a total of 10 times. So by bringing what we do best, we can contribute to the current revitalization efforts that are going on in the central neighborhood.
As a result of this initiative, Care Alliance within 1.5 to 2 years will double in size. We will increase the employees from current 70 employees to almost about 135 to 140. Our budget right now is $5.5 million. Within 1.5 to 2 years, it will grow to almost about $12 million. So we are at the growth phase of the organization right now.
The Cleveland Foundation doesn't make a lot of large capital grants. It's really pretty rare for us. And the fact that we stretch to the point of providing this support for the new capital effort, I think people need to understand the importance we place on Care Alliance.
An investment in Care Alliance is an investment in mothers, infants, children, teens, in each and every member of this community.
40% of the residents of the central neighborhood are children. They're 18 and under. By investing in Central, by bringing the needed healthcare, dental care, wraparound services, we're investing in the next generation of Clevelanders.
Care Alliance is an organization that doesn't come to the community too often. It really only comes at critical times. And I think this is a critical time. It's really a time for the community to step up and support Care Alliance in this important work. It will lead to a long-term improvement in this community when this new clinic is up and running.
Care Alliance, because everyone deserves quality health care.